WHO, the World Health Organization, says the world could face more than 34 million new cancer diagnoses every year by 2050. That is 67% more than in 2024, and the WHO describes the future burden as nearly double. But that's not the whole story. This projection does not mean everyone's personal cancer risk will rise by 67%. It reflects a world that is growing older and larger, and it exposes how much cancer can already be prevented and how strongly survival still depends on where you live. The new Global Status Report on Cancer in 2026 was produced by the WHO with International Agency for Research on Cancer. Its underlying analysis combines cancer registry data and statistical models to estimate 34 cancer types across 186 countries and territories. For 2024, the researchers estimate 20.6 million new diagnoses and 9.8 million deaths. Their demographic projection reaches 34.4 million diagnoses in 2050, usually rounded to 35 million. That is a 67% increase from 2024, not a literal doubling. The scale is already enormous. About 1 in 5 people worldwide is expected to develop cancer during their lifetime. Lung cancer is currently both the most frequently diagnosed cancer and the leading cause of cancer death. But I'm going to ask, what's behind these numbers? The largest driver is population arithmetic. The world is growing and more people are surviving into older age groups where cancer becomes far more common. Even if age-specific cancer rates stayed exactly the same, a larger and older population would produce many more diagnoses. That is the distinction most frightening headlines lose. The report projects the total number of cases in the world. It does not predict a 67% increase in every individual's biological risk. Risk factors can still push the future higher or lower. Tobacco, alcohol, excess body weight, physical inactivity, air pollution, and cancer causing infections all affect incidence. Better prevention could bend the curve, and on the other hand, worsening exposures could make it steeper. One question that comes to my mind is that, so what? What can I do about that? Based on this report, nearly 4 in 10 cancer cases are linked to factors for which evidence-based prevention already exists. That includes tobacco control, HPV, and hepatitis B vaccination, reducing alcohol exposure, healthier weight and activity, infection control, and protection from environmental carcinogens. But preventable does not mean every cancer is the result of one person's bad decision. Exposure is shaped by workplaces, poverty, pollution, food systems, vaccine access, and public policy. Prevention is not only advice to individuals, it is also infrastructures. The most disturbing findings of GloboCon 2026 is this. The report shows that biology is only part of a cancer outcome. 5-year survival rates for breast cancer is about 87% in high-income countries, but only around 42% in low-income countries. Fewer than 1 in 3 countries include cancer care in universal health coverage packages. So, 2 people can develop biologically similar tumors and face completely different futures because one receives screening, pathology, surgery, medicines, and radiotherapy, while the other one encounters delay, cost, or no service nearby. And that is just sad. These are estimates, not exact headcounts. Cancer registries vary greatly in completeness, and the 2050 figure assumes current age-specific rates combined with population projections. Prevention, detection, treatments, and risk factor trends can all change the final number. So to sum up this video, is the world heading toward an unavoidable cancer apocalypse? No. The report is a warning, about demographics, prevention, and inequality. The population will age, which means cancer systems must expand faster. If known prevention and early treatments reach more people, millions of future cases and deaths can be avoided. If they do not, on the other hand, the rising burden will hit hardest where care is already weakest. The future number is not destiny. The most frightening part is that we already know many of the interventions, but we still do not deliver them to all the people. Did you like this video? Here in this channel of Science and Other Demons, I'm trying to talk about science, philosophy, and other stuff without the hypes. If you like such a thing, you might want to consider subscribing.